So we're back with our next proof of concept video. This is for our cricothyrotomy demonstration. Just first, we're going to walk through some of the indications and some of the stuff you'll need. You want to jump in?
So indications wise, surgical crack is obviously used in procedures where you can't intubate and can't ventilate. Obviously, a failed airway attempt is detrimentous for the patient, and it's a lot of anxiety inducing, for the provider too. So learning how to do a surgical crack is an essential skill for all providers. That being said, there are certain clinical scenarios where, for example, if you have severe facial trauma and you can't intubate the patient, you can do a surgical crack. If you have some sort of obstruction just above the cricothyroid membrane, you can do this. And there are other indications, but the most important one is obviously if you can't intubate or you can't ventilate. That being said, there are certain contraindications, one being in children. In children, we prefer using a needle crack, but obviously if you have to do something life-saving, don't hesitate. That being said, we're going to move on to what the materials and methods. So what do we exactly need to do a surgical crack?
So one of the things you'll need first is a model kit. Ours looks like so. Schematics are linked in the description below. Also be sure you have a bougie, an ET tube, syringe to inflate, Kelly's, a blade, modeling clay. We are again using Crayola air dry clay.
Yeah. So that being said, now we're going to move on to, and obviously we need tape. That's going to be our cricothyroid membrane. So we've talked about the indications, we've talked about the materials. Now we're going to talk about how to set up the procedure. So Micah, this way. So you take a small strip of tape and you place it over the cricothyroid. That's going to be your cricothyroid membrane. So now I've done my best to flatten some clay. Keep that, and that forms the skin. So this is how a real model should look like. This is once you reset. And now when we're going to go ahead with this, once we do, so let's assume this is a patient. So Kevin's going to assist me with this. So we've got everything, Kevin's holding it. Kevin's going to stabilize the larynx for me.
Actually, make sure we're on here. Yeah.
So we hold the larynx like this, and usually the cricothyroid membrane is 1 finger breadth below. So I feel this is the laryngeal prominence, and right here is the cricothyroid membrane. So I take my blade. This is a number 11 blade or number 15 blade, and you make one horizontal incision 4 centimeters. So hold here, keeping it this thing.
Vertical first.
Vertical first. So making one vertical incision. You've made the vertical incision about 4 centimeters. Once you've done that, you're feeling it here, and you go in and you make one stab incision here. Once you make the stab incision, take your Kelly's. If you don't have retractors, you can use that, but if you have Kelly's, go here. So this is the point, and you extend. So we've extended it, we've extended it, we've extended it. This is our point where we have to pass the tube. This is a 5-0 tube. Obviously, in clinical practice, you use a 6 tube, but our model is quite small, so we're using a 5-1. Apply lubricant jelly or any sort of lubrication. In the real world, you'll have a lot of blood, you'll have a lot of secretions. So, you don't need that, but for this you need. We don't have any lubrication, so it's going to be a bit difficult. So we pass the bougie through, and we pass the tube. Once you pass the tube, hold. Kevin, can you inflate?
This is the hardest part of the procedure. Inflate your cuff.
Inflated the cuff. Holding. You can see that it's stuck, and just take out the tube. And if you have a bag mask, you intubate, you ventilate, and that's basically it. So this is part 2 of our educational series, and we are going to keep coming up with more videos for ultrasound trainers, procedural trainers, and we'll see how we move from there. See you guys.